Hi everyone, this is Cynthia Ryan. I'm the Executive Director of the Vestibular Disorders Association, and I wanted to welcome you to our webinar today, Concussion and Dizziness, how are they related? I know that I don't have to tell you why that's an important topic. I'm probably preaching to the choir here since you signed up for this webinar, but you know, from Vita's perspective, we're hearing so much in the media about professional athletes who have concussions, who are suffering dizziness and other vestibular symptoms, and we're also very concerned about youth athletes who suffer concussions participating in contact sports, and as well, we know that our military service men and women often come back with concussions from trauma and blast injuries. So there are a lot of reasons that we know that concussions happen, that they result in dizziness and other types of vestibular problems. It's becoming more well known, more of a topic, and we want to kind of bring that together and talk about how they are related and what can be done about it. So I'm really grateful to have Nicole Sarah here today to present this topic to us. Before I hand it over to Nicole, I just want to make a few logistical announcements. If you haven't used GoToWebinar before, when you log in as a participant, you are in listen-only mode, so you're automatically muted. But if you're having any problems or you have questions, please feel free to use the questions bar in your GoToMeeting menu bar. You can type in a question. If it's a technical issue, I'll try to respond to you as we go along. And other questions, we will wait till the end, and I'll kind of see what the general questions are and summarize them, present them to Nicole, and she'll try to answer them. If there are questions that we don't have time to answer today, we will try to respond to them by email. This is being recorded, so we will have a recording available for you and for anyone who couldn't make it today later on, and that will be available on our YouTube channel. With that, I think I'll go ahead and pass it off to Nicole. We'll get started here. Nicole? Whoop. It looks like Nicole is muted at this point. I think she's gonna, we have some technical issues sometimes on our end as well. Hold on just a minute while Nicole figures out her technical issues and gets unmuted, and then she's going to go ahead and start us off today.
Okay, thank you, Cynthia. Thank you for the introduction, and thank you to Vita for highlighting this link between concussion and dizziness. So I'd like to start off, if I could, just by Cynthia wanted to take a little bit of a poll. So we're going to look today at what is concussion, and we want to get a sense for where you're coming from and what your knowledge is at the moment. Cynthia?
So what we'd like to do is start with a poll to find out who is participating in today's webinar. It will help Nicole to gear the content of the webinar and maybe the questions that we have at the end hopefully can be geared more toward you, depending on how many of you we have here. So it looks like so far the people that have responded, we've got about 19% patients and about 81% medical professionals. So Nicole, I think that we certainly want to speak to the medical professional level and patients. Hopefully we can do that while still keeping it at a level that it all makes sense to you. How does that sound, Nicole?
Sounds great.
Okay.
Okay. So the two main things we're going to discuss today are what is a concussion and how are concussion and dizziness related. So for some people, they'll experience just a concussion, other people will experience dizziness, and some people, unfortunately, will experience both. And sometimes it can be a very difficult puzzle unwind, or a different thing to kind of, you know, get your head around. So sometimes dizziness gets missed in the process and it's left untreated, and that's one of the reasons why we wanted to have this talk today. The concussion, and how are concussion and dizziness related? That's what we're going to look at today. So concussion is a brain injury, also called a mild traumatic brain injury, and it can occur after, again, direct or indirect head trauma. You may or may not lose consciousness when you have a concussion, and most people, if they have any brain imaging or brain scans that are done, they'll have either an MRI, a magnetic resonance imaging, or they'll have a CT scan, and usually those are actually normal. There's nothing to see there, because a concussion, that's not really where the changes occur for people who have a concussion. When you have a concussion, there are several possible changes in the brain, but they tend to be more at the level of either the brain chemistry, for example, the neurotransmitters, or at the level of the hormones, and also changes in brain connections or neural networks. So the different areas of the brain actually speak to each other. And the newer imaging techniques that are out now have shown that changes in brain pathways can occur. So you've got here of the continental US, and you can see all the different flight patterns that take place. It's kind of the same thing in your brain. You've got certain pathways that are used quite a bit, and other pathways that are used a little bit less often. And unfortunately, after a concussion, some of those pathways are affected. So who gets a concussion? So it's estimated that there are about 1.6 to 3.8 million sports-related concussions each year in the US alone, and about 250,000 military service members between 2000 and 2014 suffered a concussion. Professional athletes, youth and young athletes are often thought of as the folks who go through concussion. Now, it's tempting to only think of sports as a cause of concussion, but that's not the case. Actually, most traumatic brain injuries occur due to falls, and the next after that, that's about 40% of patients who experience a concussion. The next after that are sporting activities. Again, we've discussed those. Motor vehicle accidents, assault, or struck by an object in some way. So how do people feel after a concussion? Well, there's actually a wide range of symptoms people can experience. And there are four main categories. This is one that's presented by the Centers for Disease Control in the US. So there are thinking and memory, remembering issues that can come up, physical issues, emotional or mood issues, and issues related to sleep. And so your doctor or your physical therapist or your physiotherapist will likely ask a range of questions to get a picture for how you have been affected by concussion, because each person presents with their own sort of cluster of symptoms. So it's a little bit takes a bit of time to understand how it's affected you. So it can be really helpful to know what your normal is, because if your doctor is asking you questions like, how's your sleep, how's your mood, you know, how's your balance like, it'd be nice if we actually had a baseline sense of what normal was for you. That's actually more easily done in the sporting community, because there's a rule for baseline testing. So at the beginning of the sports season, the way it works is that a series of balance and brain function tests can be done at the beginning of the season, and should someone have an injury, sustained injury of some sort, we can always look and see if they've had a concussion. That's something that can definitely be done. So clear comparison before and after is definitely one of the best ways to figure out if someone has sustained a concussion. We'll actually talk a bit more about that further down when we get to the names of the different tests that are available. So what should you do after a concussion or a suspected concussion? Concussion itself, for a diagnosis, is a clinical judgment, so it's ideally made by a medical professional. So the signs and symptoms may be subtle, or they may be a bit stronger. You need to observe the person probably over 24 to 48 hours, because sometimes the symptoms show up a little bit later. And children are recommended to see a pediatrician. What should you do? Should you see someone, or should you yourself be in a concussion situation or a potential concussion? The single most important thing you can do, and probably one of the best take-home messages, is stop activity and rest. Just even in that moment, just stop and wait and see what happens. If you suspect a concussion, the single most powerful thing you can do is stop activity and rest. Concussions may be made worse with physical activity or exercise, remember, it's a metabolic brain injury. So if you go and do exercise, you're actually continuing to tax your brain right after it may have been injured. And also, people who have received a concussion, unfortunately, their balance and their timing and their reaction times may be affected by the concussion, and so they may be more prone to getting a second hit, a second injury, fall, or something else. So you may be preventing further injury. So stop activity, seek professional and medical evaluation, and again, do not return to activity that same day. So that's nicely kind of summed up in the when in doubt, sit it out. And that's probably the single biggest take-home you can take away at the moment. So in terms of the baseline testing that we talked about, they really are geared, unfortunately, for specific situations like athletes or for children. So there's the SCAT-3, which is the Sport Concussion Assessment Tool, which is a fantastic tool. There's a SCAT-3 child version, which came out a little more recently, and there's impact testing, which is a series of tests that someone can go through at the beginning of the sports season. So what should I do after a concussion again? So the concussion information, there is a lot of really good information online. A census meeting that happens about every 4 years. It's a collaboration between researchers and clinicians. Every couple of years they come out with the new Zurich consensus guidelines, and they inform everything down the, that you see below there. So the Zurich guidelines are really important to all of us. It's an international group again, and they're fabulous, and they're really making sure that we're doing the best that we can to help people early on, as well as guide them through the process. So in the US, I guess probably the biggest groups that have taken the Zurich information and made it accessible are probably the American Academy of Neurology and the Centers for Disease Control. They have a really great Heads Up campaign. I'm from Canada, so here in Canada we have the Ontario Neurotrauma Foundation, the Parachute, which is also the Think First campaign, and the Concussion Awareness Tool, the CAT Online. Those are some fantastic options here that we have that provide good information. There are also some really good apps and some good information out there in other forms of media as well. So just make sure that anytime you're getting general guideline information that you're sourcing it from someone who's reputable, and ideally someone who's citing the Zurich consensus guidelines. So will you recover from a concussion? Concussion symptoms can last for minutes to months or even longer in some cases. With proper diagnosis and management, though, most people do recover, and recover fully as well. Recovery time may be longer for children and for teens in particular, and unfortunately multiple concussion definitely complicates recovery, so that's one of the reasons why we encourage people to wait until they're really ready to go back to sports so that they don't sustain a second concussion as well. So we do recommend that you follow the well-established return to play, return to work, return to learn guidelines. There's the CAN Child Return to Activity for Children and Youth. At the bottom there you'll see a link to CAT Online. They have good protocols as well. You also have 3 handouts that you can download from this presentation, and a couple of those from the CAT Online are there. One is a return to learn and the other one is a return to play guideline. So there are fantastic free education modules available. And with the CAT Online program, and I believe with the CDC Heads Up program, they have something similar where they have different entry points for different folks. So whether you're an athlete, parent, coach, whether you're a teacher or educator, administrator, whether you're a medical professional, there's kind of like there's different levels of information for each group, which is fantastic. So we're going to switch gears here a little bit. We've been discussing concussion up until now, and now we're going to move from concussion alone and looking more at the dizziness side of things. The vestibular system itself is a medical term which relates to your inner ear, and I think Cynthia may have a poll for you at the moment. Cynthia?
Yeah, thank you, Nicole. So just to get started here in our discussion about the vestibular system, let's get a sense of how familiar you are with the role the vestibular system plays in balance. I'm guessing that since most of you are medical professionals, and I'm guessing that you probably are vestibular professionals since you're coming to us through VITA, we're going to get a pretty positive response here, and indeed we did. 100% said that yes, they are familiar with the role that the vestibular system plays in balance. So I'm going to guess that that means that we don't need to, we can get into a lot of detail here without trying to remain too general.
That's great, fantastic. Happy to delve into the detail. So let's start doing that now. Let's see if I can get this going. Okay, so the vestibular system is important for balance, as you know, and it keeps your vision stable as well. So we'll return to this in a minute. So you can see here that if your head is hit or if you're thrown back and forth, you inadvertently shake up your vestibular system as well. So any head trauma may cause a concussion, may cause head trauma, and it may also independently cause vestibular dysfunction. So where does that happen? A direct or indirect blow to the head can cause damage to the inner ear in several ways, damaging the nerve itself, the vestibular nerve, the cranial nerve 8, as it comes away from the vestibular system there. You can see a little picture of the yellow popping on the side there. What some people call crystals, what's often known as benign paroxysmal positional vertigo, crystals that are inside the inner ear can be let loose or moved around or what have you, and they can cause disruption there. The actual membrane itself can be ripped, torn. You can have a number of different problems that can happen to the membrane itself. And the fluids as well. You can actually get pressure between the different fluids, the endolymph and the perilymph, the different fluids that are actually bathing the vestibular system, if you will. So it can affect how the vestibular system itself works and how the brain and the vestibular system work as a team. So a lot of patients will complain of things like being bothered by visually busy environments, and they're really not sure who's moving, if they're moving or someone beside them is moving. So you know that moment that everyone's had where you're sitting down and you've got the train beside you and you're sitting in a train and one of the trains moves, and for a second you think, oh, is that me or them that's moving? Well, a lot of these patients have trouble differentiating those subtleties that we can all get caught off guard with, but they have a particularly difficult time navigating those situations. So does it matter if my vestibular system or my balance system is affected? I would say it definitely has a big impact on people, but I'll let you see it for yourself. So let me show you what your vestibular system does in a very sort of cute way. It's the reflexes that keep the world stable are often taken for granted. So if you're watching television, generally speaking, it doesn't move around too much, whereas a home video, you can often see when someone walks around how much up and down and side-to-side movement there is when someone takes a handheld video. And oftentimes, obviously in movies and stuff, they have internal from that video. You can see how automatic those reflexes are, and the chicken doesn't have to do anything. They just simply have good head control, and they have stable vision. So this is how it works within us. When you turn your head to the left or to the right, the fluid sloshes back and forth in the vestibular system. This is normal. It knocks over the hair cells, the detection cells. The information is sent down the vestibular nerve. You'll see it in a second going down the yellow nerve there. The information goes initially to the brainstem. The information is shared back and forth from the left side. It compares what's going on the left and the right side, and the information is then shared up to your eyes so that you can turn your eyes back to an object and keep your gaze stable. So if you were to sit right now and have your thumb in front of you, and you turn your head gently back and forth just like she did, you can keep your eyes on your thumb without your thumb getting all blurry. You could imagine, though, if you took a video camera and walked the video camera back and forth, things would just slide back and forth. You'd see that visual sliding, but we don't have to deal with that. We've got this internal stabilization process doing it for us. And so when this is lost, it's actually very deeply disturbing to people. And people have very strong symptoms. So your vestibular system does important work behind the scenes. The vestibular system is difficult to appreciate until you lose its function. It tells you when you're moving. For example, when a plane's taking off, you can feel it rushing down the runway and taking off. You can feel the acceleration, the deceleration, the tilting, and, well, geez, I hope it doesn't drop, but if it did, you can feel all those things. But have you ever noticed how when you're in an airplane and you're at cruising altitude and you're not changing the speed, you're just kind of cruising along, how it feels like you're sitting home watching a movie? It's because there's no more acceleration or deceleration or tilting. your brain's able to, through the vestibular system, your brain's able to understand how you're moving through space. Again, it also keeps the world, like your vision clear. It keeps the world clear. Again, we saw that in that video with the head turning back and forth. It helps keep your balance, and it helps you in conflicting situations. So again, back to the idea of you're sitting on a train, and one train goes to pull away from the station, and for just that split second, you're not sure if it's you that's moving or the other train. So that's when it really comes in and helps you day to day to make decisions about where you are in space. And my experience with people is that if you don't know where you are in space, it's very, very difficult to try to figure out where to go. So if you don't know where you are, where do you step next? Where do you turn next? How do you keep everything stable? So trauma to the inner ear. The vestibular system is a sensory system, so the symptoms tend to be related to how people feel on the inside. A lot of people who live with dizziness problems often report feeling like it's difficult for people to understand how they feel because the symptoms are very internal. It's kind of like pain. You can't always see pain. Sometimes you can see a red swollen joint, but other times you can't see the pain someone's feeling on the inside. The same thing's true for dizziness. So feelings of vague feelings, or either strong or vague feelings of dizziness. Feelings of vertigo. Vertigo is generally speaking, it's a medical term that we use for what people describe as spinning. It's a subjective experience of nystagmus, technically, but it's a strong feeling of spinning, tilting, or sometimes a strong feeling of falling away. Nausea and sometimes vomiting, imbalance or falls, and that's something that we can test more readily. Blurred vision, hearing loss, and noises in the ear, sometimes known as tinnitus. So what should you do if you find yourself with these kind of cluster of symptoms? If you're experiencing those kinds of symptoms on a daily or regular basis, there are healthcare providers that are specially trained to diagnose and treat vestibular disorders. For example, there are doctors such as ear, nose, and throat doctors who are specialists, and then there are physical therapists like myself. I'm a physiotherapist. In Canada, we tend to say physiotherapist. So if I make that mistake in the future, please know they're interchangeable terms here. So when someone sees you, they'll start off by taking an extensive history, then going through the physical assessment. It will involve things often like looking at your eyes, looking at the reflexes in your eyes, looking at how you hold yourself with your balance, your posture, how you walk, how you navigate more complex or difficult things, such as with your eyes open and closed, that kind of idea. And then treatment, and we advocate for customized treatment for you based on how you're presenting. So ask your family doctor for a referral to a concussion clinic or sports medicine doctor. And also, if you're having trouble finding someone in your area, you could try contacting VITA. VITA does have a finding and helping and supporting kind of link there, so you can often find a provider in your area. Here we are. So the specifics of vestibular rehab, what does it often look like? Well, it depends on the cause of your dizziness, and it may include vestibular rehabilitation therapy. Sometimes it's referred to as VRT. Sometimes it's just called vestibular rehab. Sometimes it's just lumped under physiotherapy or physical therapy. Hands-on treatment to treat your neck and your body or your body movement. Coping strategies that you can implement to try to improve your dizziness day to day. Education and falls prevention. And also sometimes there are medications that can be helpful. Sometimes it's for the dizziness itself, and sometimes it's for the other issues that come up through the process. So sometimes, for example, someone will have difficulty sleeping, so they'll speak to their physician about medications that may help with their sleep, for example. So what does vestibular rehab look like? So your rehab program should be based on your goals. So that's a really important step that the physical therapist will always do. They'll always make sure they have an understanding of what it is that you want to do. And it will always be customized to you as well. Your physical therapist will help you progressively challenge yourself within each of the domains that I've listed here and work with you to achieve whatever goals you have. And the idea is that we're actually trying to sort of train the brain. So there are a series of different types of eye exercises you can do, balanced walking sort of exercises, gait retraining, and challenging yourself that way. motion sensitivity. That's actually sensitivity to visually busy environments, as well as if you're having difficulty moving your body through space, so whether it's body movement or visual movement. Exercises specific to sports or work, and assistance planning for graduated return to work, return to sports, return to school, and other activities. Physical therapists also provide information on diet, exercise, sleep, trigger prevention from in terms of coping skills and giving you a sense for what options you may have, conservative options that you may have. So will vestibular symptoms improve with rehab? Yes, they do. You'll develop your own sort of toolkit or bag of tricks that will help you to reach your goals. So it often includes, again, a combination of exercises that are specific to you that help the specific deficits you're having trouble with, lifestyle changes, and coping strategies. So here's a little picture of Felix the cat and his magic bag of tricks. And that would be the ideal situation, is that you get a nice big bag so you've got some reserve and you can deal with challenges and new challenges as they come up as you regain more and more function. So concussion recovery. Consider how the concussion and vestibular symptoms impact return to sport learning and work. In particular, this can be challenging for children and for parents and for the school system. The idea, of course, would be to watch your child and see what you see. So help children to find words to describe what they're feeling. For example, a lot of kids have a difficulty finding words for dizziness and blurred vision. However, if you see your child kind of rubbing their eyes or straining to see, you should be sort of talking to them about what's going on there. Also for more general things like irritability, if they're tired, that kind of idea as well. And also help them to identify specific tasks or specific environmental triggers, for example, light or noise sensitivity, so that they can better negotiate their day as well. And helping them to understand why they have their symptoms is really important in children. I mean, it's important for all of us, but in particular for children. A lot of kids feel quite confused by the experience. So graduated return to school is the priority over sports. So the idea would be that you do a graduate return to school program and then a graduate return to sport in that order. So return to learn, it's often called, and return to play for children specifically. A team approach is often best, so the child, parents, medical professional, teacher, and guidance counselor often work together for the return to learn plan. And the return to learn plan should be completed again before return to play. Children often learn new strategies, such as sometimes they're called brain breaks or mini breaks or micro breaks. Different people use different terms, they're all fine. Ways to improve concentration or memory, and they learn how to reduce their blurred vision or dizziness. That's usually through exercises and strategies, of which there are quite a few. So this is an example of the CAT online, which again is a free education module you can take, and they also have simple downloads like this one here. So this is from the British Columbia Injury Research and Prevention Unit that we have here in BC. So they have stages 1, 2, 3, 4, 5, and 6, and it's pretty easy to use. It's fairly well laid out. It does help people to give them some sort of markers and some goals to work towards. And that's, again, a separate handout that you can actually download yourself as well. In terms of return to play, gradual return to physical activity in sports is recommended, especially important for contact sports. And there are many excellent guidelines available. There are some that are sport-specific, and there are others that are a bit more general, such as the CAT Online, the Center for Disease Control Heads Up program, and the Master Can Child programs. The Montreal Children's Hospital Trauma Concussion Kit is also a really helpful one, especially because they have a bit more detail for the different sports, such as rugby, soccer, basketball, football, hockey, just to name a few. There are actually quite a few of them there that are worth considering. Just to keep it simple, we've also chosen the CAT Online information here, so you can see that in that same sort of format, they've got the stages 1, 2, 3, 4, 5, 6 that are very helpful. Here's another one just to give you a sense that some of them are there's different ways of kind of presenting this information. The similarity is still there. All this information is from the Zurich guidelines, but how it's implemented varies a little bit from location to location. So you can look through these and see which one's more relevant for you and your child, should you be working with children. So return to work, in particular for adults, I guess, it needs to be customized again to the individual. It depends on the person's symptoms and their work. You need to consider dizziness with head turns and body movement. For example, if someone has to drive and they drive through a lot of kind of suburbs where they stop and turn left, right, and then drive again, they might feel more dizzy than someone who's in a, driving down a country road where there's not a lot of repeated head turns. And some people in their jobs, they do a lot of repetitive head turns or body turns, and those can make them feel quite dizzy. It can also put them at risk for falls. So looking at their balance and their risk for falls is a really important key piece of this. Vision with computer tasks and with reading is really important. And tolerance to what I would classify as, in quotations, busy environments. So whether that's a lot of people moving back and forth, such as working within crowds, or whether it's lights or noise. So prevention is key. The tricky thing is it's not that easy to prevent a concussion. We really do want to prevent further concussions. The research has been really quite clear. The second concussion usually has more lasting effect on the person. So we really want to try to prevent concussions. And again, the risk of the second concussion, having one, is also much higher. And your reaction time might be a little bit slower. You might assess risk differently. We're not really sure all the different reasons that people get a second concussion so easily, but that's something that's a big deal. And again, the impact of the second concussion is generally speaking worse. So there is one little misnomer that I want to make sure that we address here, and that's that helmets and headgear, that helmets do not prevent concussions. They are fantastic for helping for facial fractures, for skull fractures. I mean, there are some pros to wearing helmets. I advocate for them strongly, but I just don't want that to be confused with preventing concussion. Avoiding head checks or hitting from behind might be helpful. There's been some research that's shown that the twisting component is possibly more damaging than just front-back. And that's something to keep in mind. And avoid on or off-field fights. That would be really helpful, if possible, as opposed to you're putting yourself at enough risk when you are doing the sport. Ideally, try to avoid the fights. And also consider whether the programs that you participate in or that you are currently a part of could have some baseline testing and some quick sideline tests that you could have available to you right away if someone does have an on-field accident of some sort. There's impact testing again, there's the SCAT, which I mentioned earlier, and the SCAT-3, which is meant for children in the 5 to 12 range. So here's an example of a patient. This is Josh here, and Josh's story is that he was injured while playing tennis during his freshman year of high school. So he couldn't concentrate on homework. He experienced constant dizziness and headaches. He missed so much school that he couldn't graduate with his class. And he became isolated from his friends and suffered from some deep sadness and depression. And Josh continues to struggle because his teachers and the school officials didn't really understand how he needed to be accommodated for and how to accommodate for him. And this is sort of one of those scenarios that you think, geez, are there things that we could have done earlier to sort of, mitigate the impact of this concussion on Josh in his life. He's at a difficult time of life for this kind of experience. It can really shape the way someone grows and how they learn. I wouldn't wish an injury on anybody. That said, I have seen a lot of people grow in pretty wonderful ways through going through a rehab process. They've learned a lot about themselves and the people around them, and they've drawn on strengths that they didn't even know they had. So there are a lot of good experiences that can happen. So what could have helped Josh possibly? Vestibular therapy to address his underlying visual and vestibular impairments may have been helpful. Some safe physical exercise would have been really helpful. The physical therapist should be able to help you figure out the type of exercise that you do. For example, if you're having trouble with visual vestibular symptoms, if you're having trouble in busy environments and being sure about where you are in space, a treadmill is not something that you want to be using. Instead, you might be using a stationary bike. See, when you're on a treadmill, we take it for granted, but you tell yourself you're walking forward on the treadmill, but you're actually in one. And so that conflict that you get between the vision system and the vestibular system can actually cause someone either more symptoms or possibly to just simply have a little stumble and fall off the treadmill. So the physical therapist can help you look at the type of exercise you're doing, and the major metrics we're looking for as we get people back to exercise are the duration, frequency, and intensity of exercise. And that's something that dosing out of that exercise is something that we take quite seriously. You're only meant to change one metric at a time, the duration, frequency, or intensity, not all of it at once. And there are rules of thumb that we have for getting people going after concussion that seem to help with patients. The team approach and helping with concrete strategies for Josh, his teachers, and his school administrators to address his cognitive and learning disabilities. Sometimes feeling like people are on your side in and of itself can be helpful. Appropriate return to learn and return to play guidelines would have been really helpful in this kind of case, and also possibly counseling to help Josh cope with the emotional challenges of social isolation and his physical limitations. It's a big thing for kids to take on. It's a big thing for all of us to take on, but in particular at that time of life. So in summary, concussion is a brain injury. Trauma can cause vestibular dysfunction. It can cause purely a concussion, or you can have vestibular dysfunction, or you can have both. If you have prolonged symptoms after a concussion, speak to your healthcare providers for assessment and treatment. And in particular, you're looking for when people have dizziness, vertigo, and that strong feeling of spinning or vertigo, blurred vision, imbalance, or falls. A number of resources that we have are highlighted here. VITA has a number of publications, and we have a couple more that we're about to be putting out as well, so please keep your eyes peeled for those. The CDC, again, has the Heads Up campaign that I've mentioned a few times. The Concussion, the CAT Online, is a fantastic resource. Everyone, of course, keeps referring back to and updating their guidelines based on the Zurich Consensus Guidelines, and there are a few others there for you as well. We can send all those. We'll have all those in one link that you can have at the end.
All right. Thank you so much, Nicole. I really appreciate you taking the time to give us this overview, and I want to open this up for questions. If you have questions, please feel free to type them into the questions box, and we do have some time for questions. If you'd like to talk to us directly, raise your hand, and I can see if we have a little bit of time to do some one-on-one questions. And again, I know sometimes questions come up afterwards. You're welcome to email us later on, and we can try to address your questions at that time. I also want to let you know, as Nicole said, we have some other resources coming out. We have a short publication, a short article that's a few pages about concussions and dizziness that you can download from our website. Nicole mentioned that if you go to our website, you can go to the educational resources section and find that there. You can also search for it. We also are going to be coming out with a we're going to be coming out with an infographic on concussions. So I invite you to check our website for that. We'll be sending, if you're not already on our mailing list, please join our mailing list and you'll receive a notification about that soon. There are also, for you professionals who are, I know there are quite a few professionals on the call today, there's a page on our website that lists trainings and conferences for professionals, and we do have, these aren't VITA sponsored trainings, but they're trainings that are put on by other vestibular professionals that are specifically geared toward vestibular professionals. And there are several. I just checked before we came on here. There are at least 4 or 5 that are specifically about concussion, and I even just recently heard about another concussion training that's going to be going on soon. So there are quite a few out there So if you're interested in additional trainings that are more geared toward professionals, most of the webinars that we offer are geared toward patients. But if you're interested in trainings that go more in depth for at a professional level, I encourage you to check out the trainings available that you can register for through our website. Again, that's vestibular.org. So I don't see anyone having any questions in general. Nicole, do you have anything else that you wanted to offer for people in terms of information about our resources for concussions before we go ahead and wrap this up?
Nothing in particular. I guess I'd be happy to answer any questions, and there's a lot of information out there.
Okay, great.
Yeah, I think it's good for today.
Yeah, okay, great. Well,
anytime with any questions.
Again, please feel free to email Vita. You can go on our website to get our email address. Nicole's email address is up here. You can email her directly or go to the Vita website and email us at info@vestibular.org. Thanks again for joining us today. This recorded session will be available on YouTube next week. I encourage you to go to, I'm going to check. It looks like we've got maybe one. I've got one person who raised their hand and might have a question. Kevin, I'm going to go ahead and unmute you, Kevin, and you can go ahead and ask your question to Nicole directly. Kevin, go ahead.
Hi, Nicole. It's Kevin Ray calling. Hi. I'm wondering, why is it harder to recover from a second, third, or even a fourth concussion?
Great question, Kevin. Thank you.
First one.
That's an excellent question. I don't know if anyone has come up with a better answer than I have. I'd be interested to know that myself. I don't think there's a simple answer to that one. We know that, so far we know that if you have a concussion, you're more prone to getting another injury, including a concussion. Like, you're more likely to fall and hurt yourself in any way, including having a second concussion. What we don't know is why is it that if someone has a concussion, they're more likely to have more permanent deficit. We just simply know that your brain can maybe either only handle so many assaults, or maybe there's a critical mass that you sort of lose. So maybe every time you get a concussion, you lose 5 or 10% of your function, and then all of a sudden it's like you've just lost just enough that you just can't function to the level you were functioning before. And it really becomes apparent day to day. It sort of has a stick value.
Kevin, this is Cynthia. I will say that while I don't know that I'm not a medical professional, I can't answer your question directly. I know that there is research out there that's primarily focused on concussions in medical, or rather in professional athletes, and not necessarily the why of it, but how it does impact the brain, how multiple concussions over time impact the brain. Many of you are probably familiar with the movie that is going to be coming out soon starring Will Smith called Concussion. And that movie is about the doctor who basically faced off with the professional sports complex in saying yes, that multiple concussions do have a deleterious effect on players' brains. Many of you probably know of the sports celebrities who have taken their life because of the brain damage that they've received as a result of concussions. This is part of the focus of the movie, and many of these celebrities are donating their brains to research so that they can find out more about what actually happens during a concussion and why multiple concussions result in a greater amount of damage. So as Nicole said, there aren't lots of answers yet, but there are lots of questions and lots of research is being done on that topic. We can that would be something that we can certainly look up and maybe send out to the attendees as a follow-up, our links to the research or articles on that. And I know it's probably quite sensationalized, but the movie might be a fun way to learn more about that as well. Let's see. Looks like, oh, I see some questions here. Here's a question. VPPV, I think that meant VPPV, and vestibular hypofunction, are they related?
That's an interesting question. So vestibular hypofunction is when one vestibular nerve or one vestibular system isn't working as well as the other side. So you have a vestibular system on the right and one on the left, and let's imagine for all intents and purposes that the right side has had some sort of trauma. So now the most common reason that people get loss of function on one side is probably something like an inner ear infection. And we do know that some studies have shown as high as 1/3 of people who had an inner ear infection go on to develop BPPV. There are a number of different studies that have looked at people with Meniere's disease and even migraineurs, and they tend to get a much higher percent of people who get BPPV. So in the regular population, about 1.5 or 2.5% of the people get BPPV, but it increases your probability of getting BPPV by 3 to 7-fold if you have had a unilateral vestibular loss or a one-sided deficit, whether that's due to trauma or whether that's due to an inner ear infection or a disease process. So we don't really know why. I guess there has been a lot of work that's been done over the years on nerves, and we think of nerves as being kind of a one-way thing, that a sensory nerve would go from the sensory organ, which in this case is your vestibular system, go up to your brain, speak to your brain, and that's it. But we actually the reality is probably a little more complex than that. And it may be that the retrograde or information coming back down from the brain back down into the vestibular system, that somehow the health of the nerve affects the health of the whole vestibular system, the whole organ. So it may be that people who have vestibular hypofunction or one ear not working as well, that the whole vestibular system doesn't work quite as well, and so they may be more likely to get some of the crystals sloughing off. That may be why, as I said, generally speaking, it's 3 to 7 times more likely than the average population that people will get BPPV. I will just also mention that the special case of trauma, we know that people who have trauma-induced BPPV are significantly more likely to have recurrence of their BPPV, and it tends to be a little bit almost stronger, and it often happens at a younger population. So BPPV may look a little different when its starting point is trauma versus its starting point being a disease process or infection, like Meniere's disease or vestibular neuritis.
Great, thanks, Nicole. There are several questions here, and one that directly relates to this presentation that I'm going to start with first, and then we'll get to the others. Why does concussion in children, why is the recovery time longer than for older individuals?
And that's an excellent question, and I don't know that we have a great answer to that one either. I think the studies in children, there aren't quite as many of them, so we may be less sure. There may be less information out there. And the other thing is with children, they're really busy learning. And when they get behind, I know it's the same thing for even being a physio, we deal with motor impairments too. When kids get delayed or behind, it's really hard to catch up. So it may be more that because all children they're such quick learners, they pick up things so quickly, it may be that because they're all quickly learning and up on this big, huge, steep incline, their school years they're churning, and families these days tend to be fairly busy. So they have very full schedules, and they're in very busy environments with 30 kids or more sometimes. So they've got these big classes, these visually busy environments. They've got computers that they spend probably way too much time on that can be challenging for people who have concussion. They may not give their brain the breaks that they need because if they're having downtime, for them that might be having computer time. It's really hard to get kids away from their computers. And just the way that the way that their life is structured, it may be that it's when they're not meeting their markers. See, because like adults who are in jobs, they don't tend to get tested every 6 weeks or every 3 months or even every year sometimes. So a lot of times people who are in their jobs, their dip in performance isn't measured in the same way as it is with children. So it may be that it's a function of children and the way their brains are recovering, and like the way their hormones and things change, and it may be that it's more the way their lives are structured. And I think time will tell which one is more the case.
Okay. Here's a good question, Nicole. At what stage of brain injury does the MRI scan show abnormality, and what symptoms occur from this damage? Does that make sense?
Yeah, so I hope I answer this properly. Let me know if I don't. Mild traumatic brain injury, you shouldn't see any changes on brain scans unless there's what they call an incidental finding or something, a finding that's unrelated to the injury that you sustained. However, traumatic brain injuries, there are moderate and severe traumatic brain injuries, and you can start to see changes with traditional MRI or CT scans as you move up. Again, there are a lot of people though who have moderate traumatic brain injuries or even severe where their brain imaging still looks pretty good. So brain imaging doesn't really have a strong role in this area of practice this time.
Okay. Here's one that doesn't directly relate to concussion, but I think it's a good overall question. Can you describe how the vestibular system integrates with the central nervous system?
Okay, well, I'm not sure if I'm going to answer this in the way the person wants, but I'm wondering if you're asking about like the autonomic nervous system. Do you think they're asking about like nausea and vomiting, how that piece fits into the puzzle, or?
Well, the additional part to that question was related to things like walking. So that sounds like it might be connected, and I'm also wondering if they might be wondering about how I guess there are peripheral and central different kinds of vestibular disorders that it could relate to that as well.
And if I don't answer the question properly, maybe I can refer you to some really good resources that VITA already has online. There's one called, I think, Causes of Dizziness, which I often recommend to clinicians to read. And another one is something like How Does the Vestibular System Work? Like it's an excellent overview of the physiology in a way that isn't sort of daunting. But I hope I get this right for the person who's asking the question. So the vestibular system, like any sensory system, has got a few different sections to it. It's got gaze stabilization, which talks to your eyes. So as you turn your head back and forth, it helps to keep the world nice and stable. It also has the vestibular spinal tract, and that deals with the balance side of the house. So if you tilt your head to the side, you'll notice that your muscles start firing. If you tilt over to the side, you lean over, your muscles will start to kind of fire up. And they'll say, hey, wait a second, you're leaning over. You better tighten up some muscles over here and move a little bit over there so that you don't fall over. And that's how the automatic little changes that your body will do to help you from falling. As you're walking, as you're standing, as you're sitting, as you lean over to grab something, it's helping you to be able to move through space but also not fall over.
So
another system, sorry?
What would the difference between a central and peripheral vestibular disorder be? I think might be part of that.
Yep. So then the vestibular system itself is peripheral. It's outside the brain itself, and it speaks through the 8th cranial nerve to the brain. So as the information goes from the vestibular system, which is peripheral, as the information is carried out with that nerve, that's still peripheral, and then it becomes central once you land inside the brain proper itself. So that's that's the magic dividing line between central brain processing and peripheral vestibular system itself.
All right. Well, one more question here. I'm going to hopefully phrase it. It's phrased in a couple of different ways. Can a fall cause superior canal dehiscence syndrome, is the main part of the question.
Okay, I can do that part first. That's what you want me to do, Steve?
Yeah, go ahead.
Okay, so very special case. I think it falls under the category of perilymphatic fistulas. So superior canal dehiscence means that there's not a lot of bone covering over top of the peripheral vestibular system. It's probably easiest, to be fair, if I do it this way. I'm going to answer one like that. So you can see here, there's a little bit of bone between the peripheral vestibular system, which is this little, there's the hearing portion and then the balance portion, and then there's this little tiny bit of bone covering between the brain, which is the hole there is where the brain would sit in this sort of slide. So that little bit of bone covering right there. And when that bone covering is really small, really skinny, I guess, or absent, that's called superior canal dehiscence. And that means that the brain is just sitting over top of the vestibular system itself. Sometimes it's usually genetic. I mean, you're sort of born with it. Most people have it. A lot of people have it on both sides. And there are times where when someone suffers a trauma, unfortunately, that tenuous relationship that you have there is somehow disrupted. And it's somehow almost amazing that people have been able to live all this time without knowing that, you know, that bone covering being there. But unfortunately, even a mild trauma can sometimes, like a slip, a fall, a car accident, unfortunately can unseat that. And then all of a sudden they express all these, you know, very difficult symptoms. So superior canal dehiscence is a very special case. And it's something that, you know, even on imaging, I've heard surgeons tell me that they're not 100% sure until they go in and see what they're dealing with, what they have there. Is that answering the question?
So if I'm hearing you correctly, what you're saying is that someone who has a superior canal dehiscence has a thinning of the bone that separates the balance organs and the brain, and then they fall and have a concussion that can exacerbate the superior canal dehiscence symptoms, but it doesn't actually cause superior canal dehiscence. Is that correct?
I guess so. I think that there are many people who live with that, the threat of it happening their whole lives, but it doesn't actually express itself until, unfortunately, a little accident of some sort can, again, they may have it to there's more than just bone in their body holding us together. There's a lot of different structures. So it may be that the trauma that they experience has unseated whatever support they did have that was giving them the separation between the balance organ and the brain.
Okay.
And they may have lost that structure, whatever that structure was.
Great. All right. Well, I think we are near the end of our session here. Thank you, everybody, for attending. Thank you for the great questions. We will we'll have this recording available on YouTube soon. And again, thank you, Nicole, for being our presenter today.
Thank you, Cynthia.
All right. Goodbye, everybody.